Okay, so we're introduced to four doctors and three different specialties. So we have Dr. David Langer and Dr. John Bookvar, who are the chair and vice chair of neurosurgery. We have Dr. Amanda Little Richardson, who is with child, and she is a chief resident of OBGYN. And then we have an ER doctor, who is Dr. Martha Markey. And so I'm just going to point out the main things that I noticed within each episode and just my overall rating. First episode, doctors being petty. So Dr. David Langer is on the phone and he sounds very irritated, and it might be a conversation where another doctor or maybe a group of doctors are planning to steal maybe one of his residents for their hospital, whatever the case may be. But it just goes to show how petty some doctors are. And in society, we look at them as these omniscient people who are supposed to hold great value, moral superiority, but there are some doctors that are petty as hell, and they're literally just people who are very disciplined, and in some cases very, very talented to have a calling to be in the medical industry, but their job does not define who they are. And we have the homeless population that is in the ER hospital. So in New York City, we have a huge homelessness issue. If you've ever been here, you will see a lot of homeless people just all over the place, especially on the trains and in downtown. And I'm not surprised that this is an issue in the ER, because in the ER they take everyone, whether you're a child, whether you're an adult, insured, uninsured, you name it, they see it all. Second episode, we now focus on Dr. Markey, who is the ER doctor, 39 years old. She's having her first child. Very normal for a lot of women who are in aggressive, very demanding careers. A lot of the times your personal life has to take a back seat, and that's the sacrifice of being in such a career. We are introduced to some clinical trial patients, people who are engaging in very risky but still very innovative research that can be very useful to the advancement of science. So that was really cool. Then we get to Dr. Amanda Little Richardson. She is the black OBGYN in this. And the reason why I'm saying that she's black is because she is black. And it's a great way to show representation of other groups of people in this particular docuseries, which I'm very happy that they did. So there is some sort of issue where she might be having an abnormal pregnancy. Her child might possibly be diagnosed with Noonan syndrome, which is pretty much a syndrome that can cause New York City, which can cause a lot of issues such as hearing loss, shortness of breath, possibly blindness. So they don't know for sure if she is tested positive or not, but that may be a possibility. Third episode, business operations issues. Okay, so I'm just going to break it down like this. Lenox Hill is a very, very small and underrated but still top tier hospital in New York City. They are competing with NYU Langone, Weill Cornell Medicine, Columbia University Medical Center. These are the Beyoncés of of the medical care system in New York City. And so Lenox Hill does not have the accommodation in order to kind of sustain large groups of people or beyond what they have, because they are such a small hospital. So we are introduced to the director of spine surgery, who is Dr. Mitchell Edward Levin, and he is the person who's voicing this concern because he's a little irritated. They're small and they have to accommodate all these people coming from Westchester, possibly affiliated with Weill Cornell Medicine. Okay. Unfortunately, we find out that Dr. Amanda Little Richardson is tested positive for her daughter. Well, we find out she's having a daughter, but her child tests positive for Noonan syndrome. Very, very heart-wrenching scene, but it's a very realistic situation that happens for a lot of women, and this is why pregnancy can be so scary. It's very life-changing. I don't know what it's like firsthand because I don't have any kids, but I can only imagine what it's like to have to live with the fact that you have a child that just might have certain situations or a disease or condition that may prevent them from. Okay, so Dr. Little Richardson is tested positive for Noonan syndrome, and then we find out, unfortunately, that Dr. Mitchell Edward Levine is diagnosed with head and neck cancer. Now, this is a very sad series of events because you go from being a doctor to where you are taking care of people in their most vulnerable moment, people, and now all of his colleagues were very emotional because more than just a coworker, he is a friend to some people. He might even be a father figure for them. He might be a mentor, someone who they always felt like they could confide in, and just always know that he is someone who really wears his heart on his sleeve in terms of being a great doctor. So moving on into the next episode, to a gentleman who is a former heroin addict. He has all these neurologic issues that is causing him to have severe headaches. And I do love the fact that I believe it was Dr. David Langer who had expressed that some doctors are very, very biased. Someone who is a former addict to them, in the minds of some people, they see it as they brought all these problems upon themselves for no reason, or they just feel like the reason why you're having all these issues is because you were doing drugs. Very dismissive of the fact that, okay, yes, this person used to be a drug addict, but that doesn't mean that they're not deserving of receiving care, let alone quality care. So I'm very happy that this was touched upon. So, 5th episode, Dr. Markey has her baby, and now she has to transition from being able to just work over an ER to now having to accommodate her schedule on the fact that she is a working mother. So it's kind of that tussle of, where do I draw the line? Where do I kind of put my foot down and say, okay, like I need to leave work at a certain time so that I could go home and be with my family. Very normal situation. We get bad news that a patient who's 28 years old, so young, is unfortunately going to die from a very severe form of cancer that he had. And this was probably the first scene that I cried because reality sets in for his family that he is going to die. And the saddest part closing in into this is when Dr. Bukvar has stated the best thing about this disease is that it is a painless death. That right there, that was the reason why I started crying, because the reality of it is that patient is going to die. He's on his death. The 6th episode, we see how fragile life is, referring back to the 28-year-old patient. Reality is starting to set in for him and he's getting frustrated, and we see the emotional and mental toll it takes on people, the caregivers, the doctors, and you just really see how fragile life is. Nothing is guaranteed. You go from being a doctor to now being a patient. And the 7th episode, now this is the episode that pissed me off. As a black person, statistically, there are a lot of data that backs up how bias towards my people, the black people in general, can be very, very harmful, not only to our quality of care, but as to whether or not we live or not. And we have a gentleman who has sickle cell, which is a very, very serious disease that literally puts you in excruciating pain all the time. He comes in, he's very, very expressive, very respectful, and he's able to communicate how he feels and things of that nature. And the reason why I didn't like this episode is because it kind of reinforced this idea of black people going into the ER, going to the doctor, and being drug seekers. Maybe in this isolated situation, he possibly may be a drug seeker, and that shouldn't be negated just because he's black. But drug seeking, I did not like that, and I will leave it to the viewers to kind of decide whether it's an isolated situation or not. But as a black person, I know far too often that there are so many people who go into the ER, they are not drug seeking, they are in excruciating pain, and they're very dismissed. So that was one scene that I just wasn't here for, just to be quite honest. And then we have the 8th episode, the final episode, just rounding everything up and really getting to know the people behind the white coats, understanding that it's a very demanding profession. Being a doctor literally robs you of your 20s, your 30s, because it is so much schooling, and then you go into residency. It's just all this training you have to do. Then you have to take your boards so that you are actually certified to do whatever specialty it is that you're they're deciding to go into. So it's a beautiful, beautiful way to kind of close out the docuseries. Dr. Little Richardson ends up having her baby girl, beautiful scene, and she's also leaving to go to California. So I pretty much believe now she's in California with her husband and her daughter and their daughter. But overall, I would give this docuseries a 9.5 out of 10. Beautifully shot, very, very expressive. You get to see different facets of doctors. They curse. A lot of people curse. Like, don't think because someone's a doctor that they're not allowed to curse. Like, they're still human beings. And I would highly recommend this for anyone who's interested in working in healthcare, specifically if you're interested in working in OBGYN, neurosurgery, ER, and then also some honorable mentions. We have pathology and clinical trials. You kind of get a little glimpse here and there of medical professionals who work in those areas. And overall, I really loved it. Netflix did a great job. And I believe there's an episode coming out on the pandemic, which, coming from New York City and living here, was crazy. So I'm very excited to see that, and I will definitely be reviewing that soon. And I hope you guys have a safe quarantine time. I'm still quarantined here in New York City, and I hope everyone takes care. All right, bye guys.